the NHS show on Socialist Telly, joined today by two excellent NHS campaigners and activists. We've got Noah Tucker, a Labour councillor in Haringey, and Nico, who has been on our shows a few times. So, guys, do you want to give a few lines about your involvement with the NHS campaigning? Should we start with you, Noah?
Yes. So, as Bonnie said, I'm a Labour councillor in Haringey. I represent St Anne's, which is a ward in the south of Tottenham. And I was interested to find out that a large GP surgery locally is being taken over because of the sale of a business. So it's being sold, and all the patient services are being sold with it from one company, which currently has the contract to operate quite a few GP services across London in different London boroughs. And all those GP surgeries, including this local GP surgery in St Anne's, are being sold to an absolutely vast United States-based health insurance company. And obviously, I became very concerned, interested, and decided to find out a bit more about it. I have to give credit to Haringey Council, which is a good, solid socialist council, and particularly Councillor Sarah James, who's our absolutely excellent political lead member for adults and health. And she found out about this deal and started publicising it. And she actually got the surrounding local councils to join her in writing letters and opposing the deal. And that's how a lot of people have found out about what's happening. It's very concerning because we're moving not just from privatisation and commercialisation of the NHS, which is already happening, to the potential for an American-style model where services to patients are really squeezed and the companies do their utmost to use the monopoly position which they get to extract money from taxpayers, literally hundreds of millions of pounds from taxpayers, and make their profits by providing a minimum service. And that's what we're worried about.
Yeah, it's quite scary. A lot of this is happening in plain sight, but it falls under the radar of a lot of people that are, you know, busy living their day-to-day lives. These things don't get noticed. So I'm always grateful for activists who are bringing people's attention to what's happened. Nico, what's brought you here?
Well, I've been an activist for the NHS for a decade, and I soon joined the Labour Party around 2011 with the idea that, you know, somebody had to restore the health service. We were seeing what was happening with the Health and Social Care Act, and in this country it looks like it needed to be Labour. But the more I read about Labour's policy, the more it was clear it needed to U-turn on what it had been doing, and Jeremy Corbyn offered a good opportunity to do that. However, it would have needed somebody in shadow health with that commitment, which we only had for a few months, really, under Diane Abbott, who supported renationalisation of healthcare, and effectively, although not explicitly, broke with Labour's support for accountable care organisations and the transformation from NHS to that US system, which is pretty much what Noah was describing, where you are incentivised financially to provide less and less. And I just recently listened again to the sequence from Sicko, the Michael Moore film, where he talks about that. When it's called managed care, but it's the same thing. And I hadn't noticed, but he said after this was brought into law originally as health maintenance organizations in the 70s in the US, he said that as a result, the state-funded care became less and less. People receive less and less. And the more that shrinks, the more space there is to be taken advantage of by the large corporations, which is what people are not getting. Because I'm bringing this to the coming legislation, and the And the fact that these takeovers of this GP don't come out of the blue, they come out from a national policy direction. And that policy direction isn't just the Health and Social Care Act. It isn't just the internal market legislation of 1990. It's also what's happened since the Health and Social Care Act. And you were talking about things not being on people's radar. Well, for something to be on people's radar, it needs to be talked about really and acknowledged. And it clearly isn't on people's radar that there has been significant moves to benefit the likes of this company by the likes of this company and other US companies. And I remember Diane Abbott calling it out in Parliament. She was naming various US companies that were redesigning services in England. And so that disappeared from the radar. Sustainability and transformation plans, not because they went away, but because the following Shadow Health team, clearly supported them and said they needed more money to reshape services to benefit these companies. That's not how it's framed, but that's what's been happening. So that's the context that I want to put today's point, the discussion point in. And
can I just come in, because I'm so glad that Nico has mentioned the issue of the Labour Party and Labour policy. And I'm sorry to say this, as a very active Labour Party member and supporter and a Labour councillor myself. The legislation that has allowed large private companies to take over primary healthcare, in other words, to basically grab parts of the base units of the NHS GP surgeries, that was carried out by the Blair-Brown new Labour government in the early 2000s. And in fact, there was a new kind of contract launch called the APMS, the Alternative Provider of Medical Services contract. That came in 2004. And as soon as it did, companies, including some GPs who became what they call doctorpreneurs, and start thinking about making profits, not just making patients better, but making money and making profits, started setting up businesses. Now, one of these businesses was started in London and grew and grew to take over a number of GP surgeries in London. And it actually grew to take over 49 GP surgeries, including my local GP surgery that I've already mentioned. And it's that firm, and I notice we've got a golden rule here to protect socialist telly, which is great. We're not going to mention names of particular companies, but it was that London-based firm which has now been taken over by this giant American corporation using legislation that was passed by a Labour government. So it's so hugely important that at least the opposition party has a policy of renationalising the NHS, so that at least the public has an alternative, that we don't have a situation where all the major parties are happy for creeping privatisation to take place and just all NHS provision to end up in private hands. And then guess what? Someday they will actually come to us and start asking us to pay for it.
It's gone from creeping privatisation to galloping privatisation, really. I mean, we saw after that act, we saw a number of GP surgeries merge with others to get larger premises. Quite often those larger premises were funded through PFI schemes, meaning that the GPs who were partners in that practice did not actually have any control or say of what happened to the premises that they worked in. And we've had the false argument for decades now about higher than ever before NHS spending. And in actual fact, what we've seen is increased budgets going to private providers within the NHS who use that money to find ways, can use that money to find ways, being very careful here, can use that money to find ways of maximising their bottom line, to benefit their shareholders and so on. And there were lots of cases of GP surgeries around that time as well, actually lobbying politicians for more freedoms, they called them. Now, personally, if I want to see someone for my health, I want to see a qualified medic. If I want to see someone for my wealth, I perhaps want to see someone with an MBA or something like that. GPs don't generally, in my experience, don't go into that line of work thinking about how much money they can make. And, you know, it's important that we are able to still have that trust and respect with our GPs. That relationship has to rely on the knowledge that those GPs are going to be doing everything in their power to look after you and to make you fitter and healthier. Without that trust, you're going to start seeing people wondering if they're being sent for procedures that they actually need, or being given the care, or being denied maybe complex procedures that are actually going to cost a lot more money. Because Nico, I think from what you were saying earlier, and what you've said as well in other shows, there's almost a financial incentive to deny expensive procedures to people because of this model of delivering care.
That's what it is. This thing called integrated care. It's about that. You have a group of providers, they come together, they have one budget, and they are rewarded financially for spending less of that budget on healthcare. That's what it is. And the particular target of it is hospital, inpatient care, acute care, A&Es, you know, the things that you're seeing happening to your local hospital, you know about. It is a target for reduction, constant reduction. And the thing about the NHS is it started out to cover everyone and everything, you know, to cover all the healthcare needs in the country, regardless of profit. They did things, the state did things that, you know, entities moved by profit couldn't and wouldn't do. And as the influence of private healthcare has increased in government, and the health services has been taken further and further away from its original goals, those services that were unprofitable are being shed. And you talk now about merging several GPs into one, which is a bit abstract. You don't actually take them and move them. They close them, another one stays open, maybe is larger. That's one of the two things that this company we're talking about is known for, is closing the GP surgeries that aren't profitable, the small local ones that aren't profitable. And another thing that it's known for, it's been criticized recently about on Sky News, was the fact that it uses cheaper staff than doctors. So you may not get to see a GP, but the cost of you being attended will be less to the company, so they can keep more. And both of those things are not something that this company has just thought of or just does once it gets a contract. It's something that's being done as a national policy. And Noah was talking about the APMS contract coming from the new Labour years. Now, it's not just that. It's I mean, yes, of course. But I'm saying what I want to talk about is the restructuring of services away from the idea that you have a local GP. Forget the local GP. And I would, if I may, share my screen. I'd like to show a couple of illustrations of what that policy looks like. Now, when one of those local GP surgeries closed down, the local CCG, let me just adjust my screen here, said, described it like this. They said, there's now a huge opportunity for patients to benefit from the services offered by local larger health center teams nearby, which is an interesting way of saying you've closed your local surgery and it's no longer local. And if I can skip here, this is a minister announcing what the policy is on that, from Health Minister from 2017. If we just listen to him, I can press play.
We're sort of migrating over a period of time to a position in which there may be, well, there are 7,500 GP practices around the country, to something more like 1,500 of these sort of super hubs.
That's an 80% reduction in GP services. Why isn't the party of the NHS, even with the most pro-NHS leadership it's had in decades, why wasn't this front page? Why wasn't this being screamed about? Why not? Because these under New Labour, these were called polyclinics, and they kicked up a huge fuss. And you had people, you know, protesting about the closures, But you also had people taking advantage politically. Andrew Lansley, Jeremy Hunt, David Cameron were complaining that this meant that people no longer had access to local GPs. So we're right, but they were going to carry on themselves, but they were just taking advantage of the fact people were angry. Now we have nobody really talking about it, and yet it's policy, as you've just seen announced. We didn't dream that. It wasn't CGI. The animation here was very crude.
We're sort of
sorry, and this is some of the effects of that.
Research suggests the number of surgeries closing across the UK has risen to an all-time high. In 2013, just 18 surgeries shut. But by last year, that had shot up to 138, affecting more than 500,000 patients.
This is a source from Pulse magazine, and they a more recent report talked about affecting 2 million patients. And so we're talking about mass closures and a policy of mass closures. That is exactly what companies like that do in order to be able to concentrate their activities in something with a larger patient list. And here's somebody from National Association of Primary Care who meet up with their counterparts in the US and discuss the application of accountable care organizations in Britain and the US, describing one of these new models of care which are going to be part of the coming legislation, and on which the person who led on them now runs this UK branch of the company we're talking about. So let him describe it. I've got a couple of clips on that particular model.
The primary care home is an integrated care provider model built on the registered list of general practice. And it's really important to focus that at a particular level, and we've chosen a level to be 30 to 50,000 people. We think that's the right size to scale and the right size to care at the same time.
That's what this idea of primary care medical homes is all about. So we've been at United Healthcare testing that model with a number of primary care practices, and the early results are quite promising, showing a 2-to-1 return on investment.
This is the current head, CEO of NHS England, when he worked at the US company he previously worked at. And we're talking about US models, we're talking about models that are designed for profit, and we're talking about the models that these companies adopt by closing our surgeries. So it's really important that we don't talk about this if we want to allow it to pass. And everybody who is involved in health policy and knows their stuff knows that it's really important not to talk about this, because then we can talk about anything but, and it can just be allowed to happen and be invisibilized. And it's the heart of the coming legislation. So I would turn the attention of people angry at this company taking over this to the political influence that these companies have nationally, and the fact that they are able to bring about policies nationally. And why do they have this power? Why can't we waltz into Parliament and say, like a law, please, I'm just going to make these changes? And that's what the head of NHS England did. He walked to Parliament and he said, well, we're just going to make these changes, and then maybe Parliament can make a law after that, which is what's coming out now. But we need to be talking about that. We need our left MPs to be talking about that, finding out about it, to be able to talk about it.
Yeah, I mean, these centralisation of GP services are negatively affecting communities right across England. I live in London, and we had, within probably about a 10-minute walk from my house, 4 separate GP practices, and the local residents would be signed up to one of them where they'd go for their care, and their doctors knew them, knew their histories, probably looked after their family members as well, and knew what the circumstances were for each individual patient. Following the hub system of managing GP care, 3 of those local services were shut down, meaning that a 90-year-old in my street could no longer walk, albeit slowly, to the GP surgery. He had to get a taxi to take him. And if you live somewhere that's maybe more remote, these problems are even worse. And then we have a problem of a lack of continuity of care at a time when people are having increasingly complex chronic health conditions requiring joined up care from a doctor who really knows them, knows where they're coming from, can see when they're poorly because they know what they look like ordinarily. All of those parts of our care within this segmented NHS are totally lost. And of course, we also get the increased numbers of patients looking to see a doctor, an increased wait time to get a routine medical appointment. And all of these things have the effect actually of building up the strain on our A&Es and our acute services in our hospitals, which at the same time, the same government legislation are looking at harmonising, downsizing, removing services from general hospitals in local communities to these supersized hospitals that will pick and choose which procedures and which amount of care, which type of care will actually be best for their bottom line. The clue is in the name. We're talking about a National Health Service, not National Health Limited or National Health PLC. It's National Health Service. And if it's not publicly provided, we can't be sure that it's going to be publicly spirited. And so long as public money is funding it, it really needs to be accountable through our politicians to be sure that it's still delivering the care that's required.
Yes, but Bonnie and Nico, I'm so glad that you've raised those points about the direction of, you know, health policy and structure in the UK, because you know, tragically, this giant American corporation is a kind of perfect fit for that direction. I've done a little bit of research about the business practices of this company in the United States. This is set out in an article I've written for the Morning Star, which is published in their web edition today. So if you go onto the Morning Star newspaper website and you just search under Noah Tucker, put my name in, this article will come up, and it details 3 court cases that this company has been involved in the United States. And if you think about this, there is so much room in the US for profiteering, profit making at the expense of ordinary working class people and at the expense of taxpayers. And this company has taken things so far that some of the things they've done have actually resulted in the company being taken to court. And I would just like to read out, if I can, Bonnie, just some of the the comments.
Horrifying.
Some of the comments of a guy who I don't know what his politics are, but some of these Americans, they just tell it like it is. You know, they're not mealy-mouthed like some of us English people. I'm not completely English, but you know, you do get my point. The State of Ohio filed a lawsuit against this company, and I'm quoting the Attorney General's press release, for running, quote, an elaborate scheme to maximize company profits at the expense of the Ohio Department of Medicaid, unquote, by using its web of subsidiary firms and subcontractors to misrepresent pharmacy costs. He even accused them of running a conspiracy to obtain Medicaid payments through deceptive means, and added, corporate greed has led this company and its wholly owned subsidiaries to fleece taxpayers out of millions. And he added, the company's actions are deeply concerning and have a direct effect on the most vulnerable Ohioans. So what they did is they used their contractors to firstly expand the prices of what they were charging the state and the taxpayer to provide patients, but then they actually double billed them. So 2 different subsidiaries would put in the same bill, each put in a bill for the same thing, and therefore squeezing the taxpayer out of millions. And there's other court cases regarding something which is actually central to the point that Bonnie and Nico, you've been making, about it being made less easy to obtain health treatment and health support and assessments. You know, if you have to go further away to visit your GP, you're less likely to do it, especially if you've, you know, got a job that makes you work long hours, if you've got a disability, if you've got a health problem itself, it becomes more difficult to visit your GP. So if your GP is further away, or if your GP or the company your GP works for thinks of you not as a patient it needs to care for anymore, but as a unit that they can squeeze profits out of, then you're less likely to have that relationship that actually makes you want to go in and get the healthcare that you've needed. So just referring to another court case that this company was involved in, basically what they did was tell their poor insurance company customers, because after the Affordable Care Act, which is commonly known as Obamacare, came in the US, millions more people, and this was good, became entitled to health insurance, and this company got in on the act. But the way they made profits from it was by saying, these, buy our insurance, these are the services available. And they had a list of practitioners and services. When you actually became ill or needed treatment or needed assessment, they weren't available. Or you went to them and then they sent you a bill because they actually had no contractual relationship with the company. So you can see they're making their money in three ways. They're putting inappropriate bills in to the state, so taxpayers pay too much. They're squeezing the actual services available, so it's more difficult to get the healthcare you need. And there's a third thing they do, which is underpay their staff. And I'm sure we'll be seeing more of that as the NHS here becomes more privatized. There was another famous court case they were involved in, where they'd been underpaying emergency room staff, giving them only 20%, I believe, of the pay that they were entitled to. The court cases are the tip of the iceberg, I think. If they've actually been taken to court a certain number of times, you can bet that those practices are being practiced in many other different situations. They haven't yet been uncovered. And the danger is we'll be seeing a similar kind of model rolled out in the UK. And it's the very good thing about it is that it's got people into campaigning, realizing that this big American company is taking over so many GP practices, and they already have a lot of contracts. They have contracts for ophthalmology, for example, for cataracts, and other NHS services. Realizing that this big American company is getting in on the act is sparking a lot of people into realization of what's going on and into campaigning. And I hope later in this program, Bonnie, we can actually list some of the organizations that are campaigning, and people can get in touch with them and join the campaigns.
Yeah, absolutely. I mean, the NHS will survive so long as there are folk left with the will to fight for it is a very important phrase from the founder of our NHS. Of course, it wasn't that long ago. It's in living memory that people avoided going to the doctors before the NHS was created because it cost money, and for working class people, you only went to see the doctor if you were sort of at death's door. And what we really need to be careful of is through this process of insurance-based systems, be they American or anything else, we're going to end up with a two-tier level of care. And we've seen very recently an example of that happening played out through the media as if there was nothing peculiar about it whatsoever. The elderly husband of our head of state, our unelected head of state, was very poorly with a heart issue. He was looked after at a very expensive, exclusive London hospital, privately paid for. And of course, the funds for that came from our taxation anyway, but he had private healthcare for that part of his treatment. However, when he needed a surgery, because it was a high risk surgery, that took place in an NHS hospital using, and all the way through this, either in the private sector or at St Thomas's, NHS trained nurses and doctors were delivering his care for free and gratis. He took that care, the NHS took the risk, and as soon as he was out of the woods of the risk from that surgery, he returned to the private hospital. Now, if we carry on down this road, what we're going to see is very much a two-tier system where things are low risk, high profit will be taken care of by the insurance companies. Things that are dangerous, risky or expensive, requiring a lot of intensive or acute care, will not be covered. Now, having been through being looked after on the NHS, when I had my third child, he was born seriously ill. I mean, really, really seriously ill via C-section, and he required ventilation and 24-hour, round-the-clock monitoring in neonatal acute intensive care. And he needed that for 3 weeks. And the fact of the matter is, no private healthcare insurance policy in the world would have covered him for that. The NHS covered him and looked after me. And that sort of level of care and expertise is only available, and it could happen to anyone who has a child or has a relative of a child with a child, or anyone can be affected by this. Insurance policies for really extreme circumstances like that could happen to any one of us do not exist. And even if they did exist, there wouldn't be the frequency of need for that sort of care available to people when they do need it without the NHS. It is so vitally important that we maintain all of our services as they are publicly provided, and stop looking at who can make the most money out of it, because the NHS is one of the biggest drivers of our economy. It's the largest employer in the country. And if the staff that are working in it are properly paid, properly treated and publicly provided, the money that goes in paying for them, for their training, for their accommodation, if they're in nurse accommodation and so on, goes back into the economy, the local economy, and generates, I think it's an extra 70p for every pound spent. And that's before you start looking at the economic value of patients who go through being treated at the NHS and then are able to return to work and be economically productive, which seems to be the only thing that a lot of politicians are actually bothered about. Bottom line is, it serves us across the piece, and we have to value it, and we have to fight these attempts to take it apart. That article was really in the Morning Star, Noah, was really chilling, and I really would urge anyone watching this programme to look it up on the Morning Star website to get more information. Nico, did you want to come in there?
Sure. I mean, what you were saying conjured up a few things. I think you're talking about public provision, and I think there's a lot of things that aren't really in our language, actually, in our vocabulary commonly used about this stuff, and there's a need to find a way to say it. But really, if we say it's important that service be publicly provided, it is like when we talk about it being well funded. The question we've been asking, like in our campaigning and so on in these years, has been, what is it that you are funding? Because that isn't static, it's changing. And it's also, what is it that we're talking about being publicly or privately provided, that's the right word, because that is changing. And the change from having a local GP and a local A&E so that everyone in the country had that broad range, complete range of care available locally with specialist services that can't be, you can't have an eye hospital in every area. That was made locally available. That was a big part of what Bevan brought. And that is being taken away. So we also don't want a publicly provided skeleton service that leaves people uncovered and going towards things they call medical deserts in the US maybe, but basically without that full provision. So it's how we talk about that, I'm thinking. So and there's an example, there's a different example, and there's a different company in York recently. There was a campaign because part of an A&E was put out to a private company. Now that part of an A&E wasn't an A&E. It was part of the new models of care. It was a US model that just does little, minor injuries. If you go there with something serious, they can't treat you. And in a lot of places where we've had A&Es, the A&Es are disappearing and to be replaced by this. Urgent treatment centers or urgent care centers are a multi-billion-dollar growing business in the US, and there are companies who are taking them over in the UK. But the point is, those things are designed to be taken over by companies. They're designed to be profitable. Now, I think in York, I could be wrong, actually. They have both the A&E and that. But in a lot of places, they're losing the A&E for that, or just losing it completely. And the problem isn't just that the company took over that thing. The problem is that system was designed for profit. And there's absurd arguments, and I've heard Tony Blair make them when David Cameron was pretending to oppose it, saying, oh, you know, people who need, you know, the more care will get it, and those who don't will get less care, as if you needed to create a separate system, as if you know, as if you went to an A&E with a minor injury and they ended up doing an arm transplant or something. That doesn't happen. The ridiculous arguments of taking away our services just so that these companies can profit. And so there was a campaign in New York, and Rachel Maskell MP, you know, campaigning. She's you know, she's often quite strong on health. She was from Unite, and so but the campaign was limited to not having a private company run that entity. And the point is, that's why the entity exists. And that is the problem. It's the problem is that our A&Es are being turned into this profitable stuff, which means we're losing the full A&E. And when you lose the A&E, you lose the whole acute hospital. It's all linked. And that is what we're not hearing enough about. And again, I want to bring it back to that, because it's the way the whole thing is structured, whether the whole thing nationally is structured for people or for profit. And those are opposite things, because for profit, you take away the stuff that people need. And when the profit doesn't matter, you can provide things that you know, regardless of whether they're profitable. That isn't on our radar properly. It's not discussed, and it's a tragic transformation. That's the word, the neutral word. Downgrading of what we had. And Bonnie, you were talking about continuity of care, you know, GP who knew your family, our local GP, you know, knew us, knew our grandma, they could follow up if something happened. That's precious, and that is being thrown out, and it's not even being discussed as a thing. It's being considered, if anything, you're supposed to frame it in your mind as, oh, well, that's a question of funding. If you put more funding, it will just magic itself back. Why? It's policy to get rid of these things. And I have a few more clips. Shall I show them or not? I've got clips on the thing. The other thing that this company is famous for, which is using cheaper staff rather than doctors, which is when you go to see your GP, you don't necessarily see a GP. Let me just share it. There's a report on it here.
They have to generate a profit to provide dividends to their shareholders. The only way you can do that from general practice is by cutting costs. So cutting costs involves cutting staff costs, so increasing skill mix, having less doctors.
You think about what the skill mix solutions are for the care functions that you need, and you build your team based around that. It might include the informal workforce that are volunteers, carers, members of our community.
How is everything going?
The practice hired more support staff, including pharmacists, physician's assistants, and nurse practitioners.
It's coordinated by the GP, but includes a social worker, mental health worker, a district nurse, a pharmacist.
Now, all that is lovely if it's as well as a GP, but if it's instead of, which is what the idea is, and you can see where it's come from, then we're losing something fundamental. So again, this is going into the legislation.
We saw exactly this problem play out when doctors and nurses were removed from the 111 emergency call phone service, and they were replaced by people that were reading algorithms, school leavers, people with no medical qualifications at all necessarily. And that was an absolute disaster. It was an experiment on a grand scale, cost a lot of money, and the level of service was so low as to be dangerous. Noah, did you want to come in?
I did, and I just wanted to support the point that has just been made, that there is absolutely nothing wrong at all with primary health care, including nurses, social workers, healthcare assistants, a physio, specialist staff looking to support patients. But not instead of GPs, not instead of GPs. You need the GPs, and we mustn't be. This used to be called dilution of labour, that you replace skilled workers with less skilled workers because you don't have to pay them so much, you know. And this is so important. I wanted to put another point that Nico has made and that you've supported, Bonnie, And that is about, what are we actually campaigning for? What are we campaigning for? Because we're not just saying, oh, well, you know, let's go back to the NHS as it was 2 years ago, 3 years ago, 4 years ago, where there was still a lot of privatisation that had come in. Bonnie, can I just quote from an early day motion that is being put forward by one of our best MPs, I think, Apsana Begum?
Yeah, certainly.
And this is early day motion 1628. And she's trying to get MPs signed up to this. And in my view, it's very short, but it kind of pulls together a number of strands about what we need. So it starts off by expressing concern about this huge American corporation coming in and taking over GPs' surgeries, expresses concern that the prioritization of profit in the provision of NHS services will lead to a loss of more GP surgeries, will hurt the quality of care that patients receive, and will further undermine the paying conditions of those who work in GP surgeries and in the NHS. So exactly the point that we've been making here. And she calls for all outsourcing to the profit-driven private healthcare sector to end, and for the NHS to be returned to a publicly funded, publicly provided, comprehensive healthcare service available to all that is free at the point of delivery. And I think it's so important. And to pick up from a couple of points that Nico was making, we're saying comprehensive. So we're not talking about, you know, whittling things down to just a core service, or reducing the amount of services that people can get, or making people travel miles before they can be assessed or treated. Comprehensive care. But she's not saying just publicly funded, publicly provided. So we're not talking about making contracts with the private sector, bringing in organizations that are making profits. You know, a lot of these GP surgeries, and there are GPs who don't want to be individual contractors or partners in a GP surgery, and they want to be employees. In my view, that's fine. Not everybody wants to have that responsibility of kind of having business operations to do, as well as doing the patient care and the medical expertise. If that's the case, why can't they work directly for the NHS? So, you know, if you have GPs retiring, and by the way, this is where a lot of these contracts, these APMS contracts go out. A GP might retire, or a GP might be fed up with the stress that they're having to deal with because of the underfunding of the NHS and the underfunding of primary care. So they might retire as a GP or resign as a GP. And then one of these companies swoops in and picks up the contract, and then, hey presto, you're running the GP surgery for a profit. Well, instead, how about the NHS taking over the facility? And if the NHS wants to employ GPs on a salary, if GPs want to work for a salary, you know, that should be absolutely fine, and we should be supporting that, rather than these profit-making companies taking over the service.
Completely right. I mean, the increased role of the private provider in the NHS has actually seen millions, if not billions of pounds taken out of NHS budgets, because operational directors, shareholders need to be paid. So it makes an awful lot more sense to directly employ all of the nurses, forget the agencies that supply nurses, forget nurses that have to work additional bank hours so that their pay will feed their family and so on. But if everyone's directly employed by the NHS, that cuts out a lot of the problems. And one of the things I'm particularly concerned about as well, just looking forward, is there's some new NHS legislation that's looking to set in stone basically the awarding of contracts without any competitive tendering or any scrutiny by anybody. They will be simply awarded by the Secretary of State for Health. And we must urge every single MP on the Labour benches, or any of the non-Tory benches, or the Tories can join us if they like to do all they can to stop that legislation go through, because we've seen how devastating it's been during the coronavirus pandemic, where PPE contracts were awarded to people that had no experience in delivering PPE, where a track and trace app was ordered from a company that had never delivered anything like that at a cost of £37 billion. This is money that should be being spent on services for patients, not profits for privateers. So we need to be putting as much pressure as we possibly can on MPs to produce motions and statements like the one Upsama has put through, the EDM 1628. Please, we urge everybody watching this to make sure they take 10 minutes out of their time to explain what they've heard in this programme to a friend or a relative, so that people become more enlightened with what's happening underneath our very own noses. And there are some fantastic campaigners out there fighting for these things, who also provide a lot more information on what we've been speaking about, who are maybe a bit less constrained about naming names and pointing fingers than we actually dare be. But the information is all out there online. Noah's article in the Morning Star is a must read. Please take a look at it. And if you don't already, please subscribe to the Morning Star. It's one of the few outlets for news that you can rely on telling you the truth, rather than the truth as the government would like us to see it.
Bonnie, can I mention an organisation called We Own It, which is running an absolutely fantastic petition. They're also encouraging people to write to their MP, or email their MP, or phone their MP, and get their MP to support Afsana Begum's early day motion, EDM 1628, that's the number to remember. And there's a brilliant organisation called Keep Our NHS Public, which very much supports the vision that Nico and Bonnie have been putting forward about the future of the NHS as a public service. And people can get in touch with those organisations and campaigns. There's campaigns springing up all over London and in the rest of England. I have to say the rest of England, because the legislation in Scotland, Wales and Northern Ireland is different. They don't have these APMS contracts. This is something particularly in England. But there are campaigns springing up everywhere to oppose this takeover by this huge American company, and with it opposing health privatisation altogether. And if people get in touch with We Own It, or get in touch with Keep Our NHS Public, they will put you in touch with local campaigners, and we can all campaign together for a real comprehensive, publicly funded, publicly delivered health service, the kind we all deserve.
Absolutely, well said. That We Own It website is fabulous, and there are campaigns right across England. I would venture to suggest there can't be anybody in England that hasn't been touched by the privatisation of our NHS. In the advent of coronavirus and everyone living their lives online, it should be fairly easy to find campaigns for services in your area. Local one to me is called Keep Our St Helier Hospital, Keep Our Epsom Hospital, and there's lots of fantastic resources out there by some truly dedicated activists, and I do hope people look at it, and also do sign up on the petitions and so on the We Own It website as well. Hopefully we've educated some people of the things that are going on and the challenges we're facing. I sincerely hope for anyone who is a Labour Party member that they get themselves to their CLP meetings, all on Zoom at the moment, and push their CLPs to propose motions to the Labour Party to support these campaigns for the comprehensive, publicly provided, publicly owned NHS that we've been speaking about. I was very privileged to be able to propose 2 motions on the NHS at Labour Party conferences previously, and I want to see those policies, which were passed unanimously, become part of the next manifesto whenever the election comes. But to achieve that, we're going to have to put a lot of upward pressure on, and we know how difficult that can be at the moment in our party, sadly. But if we don't push for it, we will certainly never get it. Thank you very much, both of you, for joining me this evening.